Joining us right now is Health and Human Services Secretary Alex Azar. And sir, thank you for being with us today.
Great to be with you, Becky. Thank you.
Let's talk a little bit about these plans, what they are, and why you think they're necessary.
Well, you know, the Affordable Care Act left about 28 million Americans without insurance, even though it promised to provide affordable insurance to everybody. And for those who have it, premiums doubled over the course of President Obama's tenure. And what President Trump is trying to do is make more affordable options available to people, just give more choice. And so these short-term limited duration plans are ones that are individually underwritten, meaning that the individual works with an insurance company to qualify for the insurance, and the insurance company decides what to cover and at what price to cover. But these can be very affordable options. They may be as much as 50 to 80% cheaper than the Obamacare exchange plans. So this is a really important option for millions of Americans who have been forgotten or left behind by Obamacare.
I understand your points, and certainly the idea that there were a lot of people who couldn't afford some of the Obamacare premiums is a good one. But critics of this say that this is an issue where the plans you might be getting are what they call junk plans. They say that because coverage won't include a lot of different issues. It's cheaper, they say, for a reason. What do you respond? What do you say back to those criticisms?
The funny thing is the same people who often criticize these are the same people who wrote the Affordable Care Act that expressly provides for short-term limited duration plans. And these plans existed, allowing coverage for up to 12 months under President Obama's entire term, right up until the end when they crammed them down to being available only for 3 months to try to force people into the unaffordable Obamacare exchanges. So what we're doing is we're restoring those plans to be available for up to 12 months, exactly like President Obama had. And we're adding the possibility of renewability for up to 3 years coverage for individuals, depending on their negotiations with their insurance company and, of course, subject to state law.
Sure. Let's talk a little bit about the plans, though. If you look at them, the medical loss ratio on these plans, these new plans that are going to be offered for longer than just 3 months, a lot of times it's about half what the medical loss ratio is for other plans that are offered by employers or the other plans under the Obamacare exchanges. And when we say medical loss ratios, we're talking about the number of dollars in the premium that go towards medical coverage. I think if you look at the largest one, it would be United Health, and its short-term plans averaged about 43.7% medical loss ratio. Under Obamacare, you have to pay back at least 80% of the premium dollars that you're making into medical care. And that's the big differentiator there, too. I understand that there may be people who need these for short term, but is this a buyer beware situation where you should realize there's a lot of things that won't be covered as a result? And while it may be good news for the insurance companies that are offering them, it may not necessarily be great news for people who are signing up for it unless they understand that going in.
Well, as with all insurance, people should go in with their eyes open and know what they're buying. And that's why we've actually enhanced the notices and cautions to individuals on these plans beyond what the Obama administration had, making sure people understand that not every health condition may be covered, that there may be caps on coverage, et cetera. But we believe in options. You know, we've had now many years of the central government here under Obamacare telling people what they should choose and what they could afford to buy. This is instead giving many millions of Americans an additional option, you know, for those individuals who are in the gig economy, who are independent contractors, who may not get employer insurance, for those individuals who may have 3 part-time jobs and not get employer insurance, for those people transitioning between jobs, for the kid who's left school and is headed to a job but doesn't yet have that insurance, or for the folks in rural America where they may not have access to an affordable Obamacare plan, and it may not even cover the doctor or hospitals where they live. This can be an option for them, but absolutely people need to go in with their eyes open, and that's why we've included important consumer protections in our regulation that we're launching today.
How else will this be advertised to people? Obviously, you're coming on and trying to make sure you get the word out. Are there plans to spend for advertising to make sure people understand what it is, because all the signups will be at the same time in October?
No, now these are private market options, and so these can be available as soon as 60 days from today. That's just the legal requirement on launching a regulation. So 60 days from today, subject to state insurance commissioners and state laws making plans available. These plans may be available as soon as then. They are not on an annual plan cycle, so they're not part of the Obamacare exchanges. They're not subject to the annual enrollment periods. They're really just going to be available. So as soon as 60 days from now, people may be able to have these affordable 50 to 80% more affordable, cheaper options than Obamacare plans out on the marketplace.
Do you anticipate that an end result of this might be that fewer people go into the Obamacare plans and that as a result there are fewer of those plans offered? We've seen a lot of insurance companies that have stepped away from the Obamacare exchanges. What does this mean for the Centene's and the Blue Cross options that are already existing in Obamacare?
You know, I really don't think that that's a concern here, because what we've found is that the Obamacare individual insurance market on the exchanges is largely drawing, to the tune of 87%, people who are getting subsidies from the taxpayers to buy their insurance. People are not likely to walk away from insurance that they're getting for free or heavily subsidized by taxpayers in order to go out into the market, go through individual underwriting, and buy a package out of their own pocket instead of that. So I think this is a bit of a canard, this notion that somebody will leave that and move to these plans. These are options for the 28 million forgotten men and women left behind by the false promises of the Affordable Care Act. There are other options for other individuals.
Mr. Secretary, you say 87% of the folks in the Obamacare exchanges are subsidized. Well, 13% not subsidized. I mean, it doesn't take a lot of some of the choice members of an insurance pool to drain away to maybe cause that insurance pool not to function as well. You don't think that's a possible risk?
No, we really think that it's quite small. Our actuaries have estimated approximately 200,000 people may move from the Obamacare exchanges over into these short-term limited duration plans, but they may also move for reasons completely unrelated to the availability of these plans. Those might have been individuals who would drop out of the exchanges because of affordability, of access of coverage, of provider networks where they live, any number of reasons. You know, let's not glorify these Obamacare exchange plans, many of which you might be paying $8,000 for an insurance plan that has a $7,000 deductible. You know, the title of the act may be the Affordable Care Act, but for many millions of Americans, that has been far from affordable.
Yeah, what I will say is that trying to figure out healthcare and trying to look at the landscape, whether you're a consumer or an insurance company or a doctor or a hospital, has been an incredibly confusing landscape for many years because of the introduction of Obamacare, trying to get ramped up to that, and now some of the dismantling of it. I guess I wonder, Mr. Secretary, where you think we'll be a year or two from now. Will there be more clarity, or are we still going to be in this kind of phase of trying to figure things out and maneuver around to see where we stand when it comes to health care?
Well, Becky, the Affordable Care Act is flawed at its core, its foundation, and how it was written. And so it is what it is there. We will continue to work to repeal and replace Obamacare with a system that is more rational, more state-based, more free market, that has more affordable options for individuals. But while it remains the law of the land, the president is committed, as he's doing this morning, to make more affordable options available to people. We did that through our association health plans, letting individuals and small businesses band together to create additional market power. We've freed people from the individual mandate tax that would tax people for the privilege of not buying insurance that they can't afford and don't want. And now we're offering these short-term plans on a longer-term basis, up to 12 months, renewable to 36 months, as just another affordable option that may be right for people. And, you know, we just believe that individuals and states ought to be in the driver's seat, not us in the federal government, if at all possible. And we do believe in the power of individuals to make these choices for themselves, not bureaucrats or ivory tower folks here in D.C.
This chipping away around the edges, though, is that just a kind of a realization that the votes are not going to be there in Congress to get the repeal and replace that your administration wanted?
Not at all. We're still very much committed to repeal and replace. It's in the president's budget. We'd like to see that happen as soon as we can count to 50 in the United States Senate in terms of votes there on support of repeal and replace. But in the interim, I've got a duty to make affordable insurance options as available as possible, and the president wants that to happen.
Okay. Thank you so very much, Mr. Secretary. We will see you soon.